Tomorrow week, you'll have your chance to decide on the future of the 8th Amendment. Should it be retained or should it be repealed? And what are the consequences if it does go? Has the 8th Amendment really saved hundreds of thousands of lives? Would its removal lead to British-style abortion rates here? Or might Ireland follow the example of other countries which have much lower rates of abortion? What do the facts and the experience of other countries tell us? Katie Hannon reports.
Ireland goes to the polls to decide on the abortion question at a time of competing forces on this issue internationally. Since 2000, 27 countries have expanded the legal grounds for abortion, and only one country, Nicaragua, has restricted access. However, recent years have also seen a pushback against the availability of abortion services. Since 2010, 32 states in the United States enacted laws restricting access to abortion. Ireland has a restrictive abortion regime by international standards. Just 3 EU states, Ireland, Malta and Poland, don't allow abortion on request up to gestational limits or for broad socio-economic or psychological reasons. So how many Irish women are having abortions in these circumstances, and how do our figures compare with other jurisdictions? There's been a 50% decrease in the number of women giving Irish addresses at abortion clinics in England and Wales over a 15-year period, from 6,673 in 2001 to 3,265 in 2016. The abortion rate is generally measured as the number of women who have abortions for every 1,000 women of childbearing age in the population. In 2016, the abortion rate among women travelling from Ireland to England and Wales to have abortions was 3.2. This compares to an abortion rate of 6.3 in Italy, 8.5 in Holland, 10.4 in Spain, 16 in the UK and 20.8 in Sweden. But the number of women who give Irish addresses at abortion clinics in England and Wales doesn't capture the full picture.
That's the figure of women that are travelling, and then we have to consider the amount of women that don't give Irish addresses. We have to consider the amount of women that travel to other jurisdictions. We have to consider the amount of women getting abortion pills imported into this country and actually having abortion on demand in Ireland currently.
There are no reliable figures for the number of Irish women who end their pregnancies with the abortion pill ordered online. Figures from 2 main service providers suggest that around 1,500 Irish women ordered abortion pills in 2016. So it's clear that Ireland's true abortion rate is higher than officially recorded statistics. But even allowing for that, we do appear to have a low rate by European standards. The pro-life campaign say this indicates that having the 8th Amendment has, as they put it, saved lives. It says that if Ireland had the same abortion rate as England and Wales from 1994 to 2014, 196,000 Irish citizens would not have been born.
But like you often hear stories from women who found themselves with a crisis pregnancy because of the 8th Amendment. They didn't find themselves in a position that they could travel and have an abortion, and now they have a lovely 2 or 3-year-old baby running around at home.
But repeal campaigners say that the legal regime being proposed for Ireland is very different to the system in the UK.
I really don't see, apart from, I suppose, to try and inflame the situation, why people keep referring to the English system or the UK system when we've never looked to them for guidance on how to do this. And one of the advantages, I think the only advantage to coming late to the table in terms of the wider European context on this, is that we can learn, and the committee did learn from the best practices in the European context, and we've taken all of the best practices and tried to channel it into our policy.
Nevertheless, a persistent theme of the No campaign is the claim that if we repeal the 8th Amendment, the abortion rate in Ireland will increase to UK abortion levels. The statistic on this poster has sparked controversy because it doesn't take into account the unverifiable number of pregnancies that end in miscarriage or stillbirth. What can be verified is that there were 190,406 abortions in England and Wales in 2016, which represents 1 abortion for every 4 live births.
I think Irish people are very, very different to English people culturally. If you look at the scaremongering around the divorce referendum, we were told that we'd have a rocketing divorce rate, but yet we have one of the lowest in Europe. So we're very much not aligned with UK, although they're near to us, but not aligned with them culturally.
You know, there are differences in religion, there are differences in culture, but when it comes to abortion, like the 1 in 5 is still such a worrying trend in the UK. It's there.
The Save the Eighth campaign has also controversially focused on another trend in the UK following a diagnosis that a fetus may be born with one particular disability.
There's no provision in the Heads of Bill for termination of pregnancy after 12 weeks, unless there's a substantial risk to life of the mother or health of the mother, but it's only in the case of fatal abnormality, not any disability.
However, it's been confirmed that an increasing number of Irish women are now availing of a private test that can diagnose Down syndrome before 12 weeks gestation.
So there is a blood test available now for about 10 weeks. It predicts with about 99% accuracy whether or not a baby has Down syndrome. The rotunda figures, 50% of women will choose to continue a pregnancy knowing their baby has Down syndrome, 50% will choose not to continue.
I believe this is a game changer in this whole debate. In England at the moment, where Down syndrome babies are diagnosed with the gene in the womb, we know that only 10% of them get the opportunity to live. And I would be very, very concerned that similar would happen here.
The culture in Ireland we have of respect for children with Down syndrome or people with Down syndrome, I don't think any removal of the Eighth Amendment is going to change that. I actually think the whole conversation around Down syndrome is quite disrespectful to suggest that somebody's only here because their parents had the Eighth Amendment to stop them from having a termination. It's very disrespectful to people with Down syndrome and to their families.
While we have much in common with our nearest neighbours, there are also clear cultural and religious differences between Ireland and England. So we've come to another relatively small, largely Catholic country on the western periphery of Europe. Here in Portugal, the abortion legislation was liberalised 11 years ago, after decades of bitter and divisive debate. In Portugal, legislation was put in place in 1984, allowing for abortion if the pregnancy posed a risk to the woman's health or life, in the case of fetal malformation, or if the pregnancy was as the result of rape. But in practice, these laws were interpreted very conservatively and few legal abortions were conducted. During this period, those with the means to travel went abroad, mainly to Spain, for abortions. Others had backstreet abortions. It's impossible to verify how many, but studies suggest that before it was legalised, there were approximately 20,000 illegal abortions in Portugal annually. In 1998, a referendum on the introduction of abortion on request up to 10 weeks gestation was narrowly defeated.
In 1998, everybody was convinced that the pro-choice option was going to win, because all the opinion polls were quite clear. Around 60% of the Portuguese were pro-choice. So for many, there was a huge surprise, the victory of the no, in a very poorly participated referendum.
In the years following this referendum, there were a number of high-profile trials relating to illegal abortion. The most controversial of these saw the prosecution of a nurse who was performing 500 abortions a year in her home. Many of her clients were also put on trial. There were 14 deaths attributed to illegal abortions over the 7 years after 2000, including the death of a Lisbon teenager who self-administered the abortion pill. By the time the next referendum was called in 2007, the battle lines were redrawn.
The campaign in favour of abortion was very intelligent, because they told, you want women in prison. And we said, no, we don't want. It's not that we want. We want to protect life. But they were very clever and very strong in the argument.
It was a concern for women that could not go to Spain for an abortion, that they were going to be prosecuted, they were going to be considered criminal. It was more of a safety problem, a health problem. There's always going to be abortions. This is always going to happen, is whether or not we want to live in a society that allows for that to happen in a safe environment and without being prosecuted.
In the 2007 referendum, 59% voted to change the law to allow for abortion on request up to 10 weeks gestation. In 2008, the first full year of the new regime, there were just over 18,600 abortions in Portugal. The number of abortions increased over the following years and peaked at 20,480 abortions in 2011. That represented 21% of the live birth rate, which is about the same rate as the current UK rate. The numbers having abortions dropped over the following years to just under 16,000 in 2016. The drop in percentage terms was more modest, as it corresponded with a sharp drop in the birth rate. This gives Portugal an abortion rate of 8.2 per 1,000 women of childbearing age, putting it at the lower end of European countries. So if the estimates that there were about 20,000 illegal abortions are accurate, the rate of abortion has decreased since the procedure was legalised. What's undisputed is that the change has led to a dramatic reduction in the number of women presenting with complications from backstreet abortions.
We decrease the number of complications about 90 to 95%. This is very important for women's health. I'm convinced by my experience that the law contributed very strongly to decrease the complications of abortion and to decrease the number of abortions.
No one knows really what's happening with illegal abortion. But one thing I know, what happens in illegal abortion is a baby is dead. What happens in a legal abortion is that a baby is dead. So the result is the same. The fact is that 1/3 of the abortions are repetitions, are people that do again. Abortion in Portugal has become a contraceptive method.
There are conflicting studies on whether access to contraception reduces rates of abortion. In Portugal, those who support the new law see a clear link between the falling abortion numbers and the measures that were introduced when abortion was legalised.
The National Health Service works very hard on education and on giving contraceptive pills, the IUD, the ring and so on, free. They are free in Portugal. Education on contraception and education in general are making the number of abortions decreasing.
What I think it's very good is that when you go for an abortion now, you do get the support, you do get the family planning. You do a number of things that might avoid a second or a third abortion, you see? And it's much more talked now. Even at schools they have sexual education, you know, so it's a different issue.
11 years on, pro-life campaigners say that it's a tragedy that for every 5 babies born in Portugal, 1 is now legally aborted. But those who supported the law say it's been an unqualified success. Women's healthcare has greatly improved, and they say because of easier access to effective contraception and better sex education, fewer and fewer women are seeking abortions in Portugal with every passing year. So what does all of this say about the potential impact of repealing the 8th in Ireland? Well, if our abortion rate moves towards the UK's situation, we could see a sharp rise in the number of Irish women having abortions. But if we look to a Catholic country with a legal regime that's more closely in line with what's been proposed for Ireland, the picture is less clear. Although the abortion rate in Portugal is significantly higher than estimates for the Irish rate, there is no hard evidence that more Portuguese women are having abortions since they changed their laws.
Katie Hannon reporting. I'm joined now by Anne Flynn of Save the 8th, who's Assistant Director of Nursing at a major Dublin Irish hospital, and by Dr Katrina Henshin, Medical Director of the Irish Family Planning Association. Katrina Henshin, doesn't it stand to reason that if you make it easier to access something, more people are going to use it, and therefore we can expect the Irish abortion rate to rise if the 8th is repealed?
OK, I mean, I think first of all it's important to reiterate what was said on that little clip, that abortion is a reality in Ireland. Irish women do have abortions. But in terms of evidence that's there, whereas it might feel that it would be logical to think that, the evidence as provided by the World Health Organization is that in countries where abortion is legalised, the number of abortions does not increase. And that's a global trend. That's across all of countries.
But isn't there a problem? I mean, we saw about the Portuguese example there. By definition, if something is illegal in a country, you're not going to have very good statistics about how many abortions are being carried out illegally. So therefore, it's a bit difficult to say with certainty that the rate has gone down.
No, and that's probably why, as was seen in that initially what you have guessed at as the rate and what the real rate is are slightly different. So initially it may appear as if it actually slightly goes up and then over time comes down. But it's only going to come down if there's a certain type of service available. So if you have an abortion service that's linked with good contraceptive care, that you also invest money in comprehensive sexual health education, that you also invest money in free, readily accessible contraception across the population. That's the only way you're going to see the abortion rate come down.
But that could be done whether you have legalised abortion or not, presumably.
Absolutely, and we have been asking for that to happen for a very, very long time.
Anne Flynn, the one thing we can say for certain about the abortion statistics in Portugal, for instance, is that they may have gone up, but they have been coming down since. So doesn't that suggest that there is at least some prospect that the number of abortions here would actually decrease after the 8th, if the 8th is removed?
No, I think the difficulty with the Portuguese figures, it was introduced, abortion in Portugal was introduced right before the recession, and they believe that the statistics were affected by the recession, that people felt they couldn't financially afford to have another child and expand their family, and that's why the statistics rose. And now they're coming back down, but they're now down more or less at the level that they were at, give or take, you know, as we saw there in the clip, about 1,000 than when it was actually introduced.
But they haven't gone up dramatically, is the point.
Well, I suppose they haven't gone up dramatically, but they were double or triple what they were before the abortion was legalised, when people were travelling to Spain.
Well, we don't have firm statistics for illegal abortions,
and I think
so we can't really say.
And I suppose I think that's the issue that we have here, that the government haven't invested in doing any sort of a feasibility study in relation to the abortions and the potential for abortion numbers. An independent actuarial study conducted by Brendan Lynch and Anne-Marie Gleeson, two independent actuaries, have conducted a study, and they've looked at 7 Western European countries, including Portugal, and looked at their numbers, and many of whom have more conservative regimes than what the government are proposing to bring in here. And they estimate independently that the abortion rate will increase by 5,300 a year. Should abortion be brought into Ireland. That's an extra 100 a week, 14 a day. And the other thing that has to be remembered, and it hasn't been put out there to the public, when we look to the UK, 40% of all abortions under 12 weeks are surgical abortions. So even looking at our rates now that we know of with women travelling and the women taking the pills that we're told are taking pills, that's an extra 2,000 surgical procedures that our health service would have to take on board, and our health service can't take that.
Katrina Henson?
First of all, I mean, I would say we shouldn't always look at England for all of our statistics, and in terms of numbers of surgical abortions, the numbers of medical abortions are much higher compared to surgical abortions in, for example, Portugal, or even, if you want to look closer, in Scotland. So the proposals that the government has put forward are of a predominantly medical abortion primary care-led service. So it shouldn't lead to all of these surgical abortions that you're talking about. It should instead allow for practitioners, and lots of doctors have signed to say that they are in favour of repealing the 8th Amendment and will be available to offer services. So if you have primary care delivered services, it can be done in a much more cost-effective way.
I suppose I'd say less than 5% of doctors have come out and have supported repeal the 8th. So that's potentially 95% that aren't. I suppose I work in the acute sector, and I work at the coalface, and I have done for the past 28 years. And I know that there are many, many healthcare workers who will not participate in abortions. And the difficulty that we have here, we're talking hypothetically. You're talking about it should be GP-led, it should do this, it should do that. There has been no feasibility study. Simon Harris, Simon Coveney, Leo Varadkar, supported by Micheál Martin, are bringing in this repeal blind, and they're asking the Irish people to vote on the blind with no impact on the health service. No, where is it going to be performed? You know, who is going to partake in it? How much is it going to cost? How many are going to be involved? There has been no feasibility study done.
Okay, just to, sorry to bring it back to the numbers just for a second. I mean, the example of Britain is frequently mentioned, and yet we do have a different culture to Britain, and you can see that in the divorce statistics. If you look at the raw divorce rate, it's about 1/3 here of what it is in Britain. So surely it doesn't necessarily follow that we would have similar rates here as they have in Britain.
We see people often quote the divorce rate, but back in 1990 there were 40,000 separated people. Today there are 285,000 separated people in Ireland. So that's a seven-fold increase. Now, I'm not suggesting that the abortion rate is going to increase seven-fold, but it does have an effect. And when you introduce something like abortion into a country, into a society, it changes the culture of the society. It becomes the norm. So now, when a woman experiences a crisis pregnancy and she goes to her doctor, she goes to her nurse, she goes to her family and friends, now abortion is the last thing that would be mentioned to her, if it's mentioned at all. Whereas when you have it and it's culturally acceptable and it's culturally the norm, it is the first thing. The first thing that would be said to that woman is, are you going to keep it? So suddenly, you know, it becomes the first port of call as opposed to the last.
Okay.
Okay, well, first of all, I'd like to say that unfortunately in Ireland at the moment, when women go through crisis pregnancies, they don't turn to their doctor, they don't turn to their nurses, because they don't feel able to actually disclose the information if in their head there is even a thought that they might not want to keep it. Instead, they either access no services, they sort everything out for themselves, and they make those decisions, very difficult decisions about whether they're going to keep a baby or not, in the circumstances where they're also trying to figure out, can they afford to travel? When will they be able to book their flights? Who's going to look after their other children while they're away? What are they going to say at work? What story are they going to have to invent to cover up this terrible, shameful thing that they're being asked to do? That is not right, and that's not the right way to be making that decision. That decision should be made in the calm of a proper doctor-patient consultation.
Well, I suppose what I'd say to you, for those that don't travel, or that do travel and have abortions, many more don't. And by making it legal and by making it the norm, it will be the norm, and it will be the first port of call, and more babies will be aborted, and more women will be left having made that decision and having to live with it.
OK, we have run out of time, but thank you very much indeed both for joining us. Miriam.
Thanks.
That's it from us for tonight. On Tuesday, Primetime presents RT's final television debate on the 8th Amendment. Until then, from Dave and myself, everyone on the Primetime team, thanks so much for watching, and Ihawa. With only days to polling day, Primetime presents RT's final TV debate on the 8th Amendment. We'll have leading figures from the yes and no sides here live in studio, arguing for your vote.
And our studio audience, drawn from both sides of the campaign, will put their points to the panel over our special hour-long programme.
It's time to hear both points of view. It's time to weigh up the arguments. It's time to make your decision.
That's Primetime, the referendum debate, Tuesday, 9:35, RTE1.